Yeah, hello again. Thank you for joining this session, Meet the Data, Accessing Data from Medical Registries. I'm Tobias Hartz. I'm from the Clinical Cancer Registry of Lower Saxony and one of the representatives of the German Cancer Registries Association, and one of the, as it was told, together with Anne Regierer, one of the two chairs of the working group registries at the TMF. And yeah, I'm looking forward to talk to you, to present how you can access our data in the example of cancer registries. And further on, after my talk, we will have a discussion how you can access in general data from medical registries, and we can have a discussion what are the boundaries to that, where you can access and where you cannot access, and what may be the reasons for limitation. What have I brought to you? Yeah, what do we have? Why do we have medical registries? It's not that we do rocket science. Sometimes we feel like it because it's kind of complex. It can be kind of complex to collect data, but at the end, we just make things countable. How many apples, pieces of apples, bananas, and stuff is in there, so we have a better picture of certain things. Are we a country of registries? We have a lot. There was, by the TMF and others, research or a report provided to the Federal Health Ministry or Ministry of Health in Germany, and they established a little database of registries. And at the moment, I just had a look at it this week. There are 419 entries of medical registries in within this platform from NFDI4Health. You find a lot of other studies and also registries. So we have a large number of heterogeneous medical registries in Germany. We have different goals, what the registries are after, different concepts. And so sometimes low comparability of registry data, and still, even we are getting better, but we still have a lack of standardization. But what we do have is billions of valuable data from medical and other areas are produced, recorded, collected, shared, and stored every day. But now the question is, how can we access this? And I brought you the example of cancer registries. Before we dive into the cancer registries, here shortly a picture of the registry database holds information about over 400 entries. If you look at cancer registries, you will also find our registry of Lower Saxony. If you have a look at the NFDI4Health database, and you put the name registry in there, you find quite a few examples, and you will also find, if you, for example, look at cancer registries and you put is it planned to share the data, you will find also an entry of our registry. Let's talk a little bit about cancer registration. It's nothing new. There were some really have a long history, but in the 90s, there were only a few cancer registries in Germany existed. And if you look the status on the map on the right side, you see white places where no data was available within the beginning of the millennium. In 2015, 2016, we had already a comprehensive overview, or you could have, we had already comprehensive data collections of cancer. There was several law acts, the Federal Cancer Registry Act in 1995, 30 years already ago. The Federal Cancer Registry Data Act establishing epidemiology cancer registry 2009. So we had a comprehensive data collection of incidents of cancer. And what we focus today in the talk, what I will focus is what happens in 2013 with the Early Cancer Detection Registry Act, short in German KFRG, the Quality Assurance Through Clinical Cancer Registries. That's also where I'm come from. It took some time, for example, in Lower Saxony to establish out of this federal law, well, out of this national law, a federal law for Lower Saxony. We started in 2018 to collect data on patients in Lower Saxony. To access the data we are collecting, there are further law acts. 4 years ago, there was a law on access to cancer registry data, that all the data which is collected in the federal states is centralized at the Robert Koch Institute, so it's easier to access those. Last year we had the Health Data Utilization Act, which in future will hopefully make it easier to use cancer registry data combined, linked with health insurance data, which is one of the aspects of the Health Data Utilization Act. Let's talk about the key characteristics of the cancer registration in Germany, the population-based clinical cancer registration, thanks to KFRG from 2013. What are the key characteristics? We have a comprehensive data catalog, over 130 items, from stage, data at diagnosis, histology, data on treatment, the progression, even genetic data, and the date and cause of death, and even out-migration data. Which differs from, in our, the reporting is mandatory by law for all healthcare providers involved in the cancer care. Either via interface that from the EHR or from the system the healthcare provider uses, that that would be the good part, that we can get that we can access the data out of his system, or the other thing, we provide portals where manually data can be put into. Special about the cancer registry is that we don't require a patient consent for storing and processing the data. This is by law. This differs to most of the other medical registries we have in Germany, that here the patient is informed, but he doesn't have to give his consent that the data is sent to us. Which is also very useful, is that we are able, or we are allowed to have the health insurance number, since we get from the same patient information from different healthcare providers. We have to link the information so that we have a good overview of the case. And we do this with the health insurance number or the address and the name in, with the name in clear data. Since we are collecting the data from patients who are treated, for example, in our case, in Lower Saxony, but sometimes people from other federal states are coming to us and get go to the hospital in Lower Saxony, we exchange those data to our colleagues of the other cancer registries. So in total, we have 15 federal cancer registries, and if a patient goes to many different states, every state has records of this patient. We have financial reimbursement for clinicians who send us the notifications, depending on what kind of notification we get, and the costs are covered by the health insurance by 90%. 10% is given the money by the federal state. Providing data is one of the aspects, the tasks we are given by law. Number 10, the provision of necessary data to create transparency in healthcare and for the purpose for research, scientific research. So we had to build up, and I think it's a good thing that the data we collect is also accessible for other third parties. To give you a little insight, what we are collecting here, we call it the OBDS, the Oncological Basic Data Set, which contains different kind of information. We have extension for specific entities, for breast cancer, prostate cancer, colorectal cancer, melanoma, skin. There are more variables which we collect. If you are interested to get to know which one, we will provide this slides afterwards, and you have the links here, so you can have deep insight. What is reported when? So we get the diagnosis, we get the therapy, we get from the pathologist the report, and which is very interesting for others is mostly the for other registries, the information what happens after the treatment to the patient. So to have the full treatment, the full progress of the case. What we have now in Germany in oncology care is that everyone who's included in the oncology care has mandatory to report to the state cancer registries. We get from the registration office data and death certificates information and combine that in our registries. And we give our information, or each case, since it's, we don't give the full data, but we have to send those to the health insurance to get for each report the money back, which we give back to the healthcare providers. We exchange the data within the state cancer registries if we have a patient from other federal states. So we have a good common understanding of the data. And our data is used for evaluation, for example, where data from the cancer registries already combined with health insurance data. We have use cases where we share our data with other medical registries. If the patient consent allows it, for example, the NACO, national cohort, where the people who are included in this cohort study are asked if they have cancer, if it's okay that the state cancer registry can provide the data for them. So we don't have to collect it twice. And once a year, all the data we have, for example, in our cancer registry of Lower Saxony, we send everything, all the information to the RKI, to Robert Koch Institute, the Center for Cancer Data in an anonymized way. And if you are now a researcher and you want to access the data, what can you do? You can either go to the state cancer registry and apply for data from Lower Saxony, from all different, from Hamburg, Bremen, from all different states. Or you can access the data from the Center of Cancer Data at the Robert Koch Institute. You see, there's a difference. They have an anonymized data. They are not provided with data of the healthcare provider, and some of the information is not, for example, the exact day, rather than month and year, which we still have, but also are not very keen always to provide this outside. But let's talk about that later. So the structure you find, it's very complicated already. 15 federal states, one children cancer registry, and one national cancer center, which is not called a registry. That's why I put it in brackets, the registry. So a lot of players who play along here, where you can access data from cancer registries. To make it more, to combine it, we have two associations, the ADT and the DKR, who try to combine the things. And also a third one is the platform from 65C, which is where we all meet together all 6 weeks to get the things more harmonized, so it's easier for outside. Okay, let's go deep in Lower Saxony and how you can access our data. We were founded in 2017, started collecting data in 2018 at July. Since 3 years, 2 years, we are stable. We started with 7 people, now we are 69, and we collect about 800,000 messages each year, and have every year about 56,000 new cancer cases, which we process. The good thing is makes it easy since the Lower Saxony is a 10% state. You can these numbers times 10 is what you have in Germany in total, roundabout. So how do I get the data now? If you go on our website, we have by law, by our federal law, the possibility that if you are a researcher, that you can access and apply for this data. As you have seen, then the application goes to the Use and Access Committee and will be processed. We will talk to you, and you can access data from Lower Saxony, from our cancer registry. As we started, each of our federal states have the federal laws, the way you could apply to data within in Lower Saxony or in Hamburg or another in Berlin was not the same. We harmonized that and we established one entry application for all cancer registries. You have to apply to each federal one by well, you have to give an application officially to everyone, but you can use one application form for all the application to make it a little bit easier. This is pretty new because this is already finalized, but not it doesn't have the layout, the new layout. It's not used yet. It will be probably published in 2 or 3 weeks' time. So we have an English version of the application now. So you have here a view how those application forms will look and what we need as information. What do we want if you want to apply for data? We want a project description. Very important is it planned to merge the requested data with data from other institutions? Do you have a record linkage? If you do, there could be a problem because you can only do this data linkage if you have a consent of the patient. If you bring that with us, otherwise it can be complicated to merge data. We request information about the duration of the project. When does it start? Till when? And what is the scientific background? It has to be described why the data you are applying for is really needed. We ask for preliminary work. Is there any publication? So we can refer to that. And what is the study design? We need inclusion and exclusion of criteria. What data is needed? What is the cohort you want to have? What kind of data? It's not possible to say, I'm a researcher, I'm interested in everything. Give me just everything you have. That doesn't work. We have to check if for your question, for your research question, what you apply for is really what you really need and not more. We ask for a positive ethic vote for the research you want to conduct. And if you have a security concept or at least some description, how you access, how you process the data. At last, we need a signature. And if you apply this, the Use and Access Committee within the cancer registries will look at the application form. This is what it looks like, the variables you are asking for. You have to make a selection. And also we ask for remarks why this or that information is needed or not. Yeah, we included an information sheet we just established, which also will be provided soon. Within the project, we are funded. We are at the moment establishing a new application platform. At the moment, you will find on our websites on each cancer registry the PDFs the application forms. You can download them, you can put them in. In future, we want to have something similar like the MEE, like a platform where you can put your application and where we can do all the processing of the application within this form. One aspect which is also important is that we have a good understanding. We have a format how we receive the information from the health insurance, but there's no standardization of the processing within the cancer registry. And if information is asked by us,
standardization within the procession of the cancer registries.
Sorry, I heard something. So far, when we got an application and someone was asking for information, there was no standardization how we provide the data. So it could be if you're a researcher and access data from more than one cancer registry, you ask for the same data from 2 or 3, that the format you got was different. And this is a pain within one of the projects we are working on at the moment. We have a standardization of so that especially if you have large data sets for example, artificial intelligence analysis, that you get the same data sets standardized. So how many data applications do we get? As I said, we started in July 2018, and the numbers are not that high at the moment, but they are getting more and more. You see that we had 4 already in 2019 for application or people who asked they would like to have data, and 2 were after we talked to them and told them, hey, we are just collecting for half a year. And at the beginning, the data quality was not as good. We were still evolving as a cancer registry. So 2 of them were denied or were given away. And at the moment, this year we had 11, or no, last year in 2024, we had 11 applications, 5 were already processed. The people got the data, 6 are still in process. And in total, in 2020 ago, we made we celebrated 10 years of KFRG. And we asked all the federal cancer registries how many data provisions did we have the year before in 2022. So there were 150 data provisions for scientific research. So the number of how this data is used is increasing. And who's applying for the data? As I said, stated before, for example, NACO Gesundheitsstudie was one of them who's regularly getting data from us. If you look at the Center for Cancer Registry Data, they have a public registry where they put everyone who's applying for data. You can look at and the number of applicants are rising, which is good. Last but not least, I have brought you some of what we can do with the data here. For example, the fulfillment rates of quality indicators in oncology care for cervical cancer, which each line is one hospital, and we can share. We had here, for example, all the data from all federal cancer registries in Germany combined, and are able to give here benchmarks to each hospital back. Our colleagues, Niels, I saw you in the call. They had analysis of patient journeys, so it's possible to see where the patients go, how the distances, and where institutions which attract information. and the reoccurrence on patient with prostata cancer after radical prostatectomy. So there are a lot of applications data, and we are very happy if we get a lot of application that our data is used in a good way. Yeah, to give some giveaways before I make some for the community, some remarks. Even though the cancer registration is was very harmonized already, it was not that easy to harmonize this path, how to apply to the data. And it's still a pain for many researchers how to access, even though mandatory by law. But since we have different cancer registries, they evolved, they implemented different ways due to the federal law, maybe also. We harmonized that. And still, if you are a researcher and you apply for data, it takes a while. We can discuss later on how long it takes from, hey, I have an idea, and here I have the data. If you are having something after 3 months, that's really, really quick. It takes more time, most parts to access the data. We are working on that it's getting more, that it's getting quicker, that you can access data earlier, because as a researcher, you have now the question, you want now your answer or play with the data. Yeah, those are one of the boundaries still, which we have to work on. But I think we are in a good way. And I talked now a lot of cancer registries, but those are only a small amount of all the different kinds of registries we have out there. And not if you have a look at all the other medical cancer, or not of other registries, they also collect data to use it in a good way, but sometimes it's not that easy to give this data to third parties, because this is also this why sometimes they don't put so much effort in for third parties, because they mainly have also their own research question they came up with, and at first they want to answer that. And yeah, we can discuss it. I just want to make some for this community, the work group for registries at the TMF. We have a next working group meeting coming up in February the 12th in Berlin. So if you're interested in registries and want to discuss with us or meet the community, you are kindly invited. Also at the Register, the days of Registertage, days of registry in May this year, which also will be held in Berlin. So if you want to meet us, talk to us, get to use our data, which I hope, yeah, use those opportunities. Thank you very much. I already used more time than I thought, and let's have a discussion.